Hi, my name is Kweku and I'm a pharmacist. In today's video, I'm going to be talking about 5 classes of medications that can be detrimental or worsen the symptoms of an enlarged prostate. Little disclaimer, this and all my other videos are for informational purposes only and it is not intended to be a substitute for medical advice from your physician. Please do not start or stop any medication without consulting your physician. Now, an enlarged prostate or benign prostatic hyperplasia, as it is medically known, is part of the growing process in men. In some men, however, it results in setting on desired symptoms collectively known as lower urinary tract symptoms or LUTS for short. Some of the most common of these symptoms include frequent urination, especially at night, a weak stream of urine, the need to urinate more frequently, and leaking or dribbling of urine. The medications that we'll be discussing today have the potential to make one or more of these symptoms worse. I'm going to start with the over-the-counter ones, and the first one on the list is antihistamines. Now, antihistamines are primarily used to treat allergies, that is to stop the sneezing, the watery eyes, and the runny nose that are associated with usually seasonal allergies. Now, some antihistamines are also sedating and therefore they are used as sleep aids. Antihistamines worsen the symptoms of enlarged prostate by weakening bladder contractions. This lessens the bladder's ability to expel the urine. This is because generally the ability to urinate normally depends upon having a forceful bladder muscle contraction to expel the urine. So if that mechanism is compromised, then of course it becomes difficult to urinate. Now here with antihistamines, it is important to note that there are 2 main classes of antihistamines. We have the first generation antihistamines and then the second generation antihistamines. Now while both generations or both classes have the ability or has the risk of worsening these symptoms, the first generation antihistamines are more likely to cause problems relative to the second generation antihistamines. Now the first generation antihistamines include things like chlorpheniramine, which is sold under the brand name clotrimazole, dimenhydrinate, sold under the brand name Dramamine, and one of the more popular ones, diphenhydramine, which is sold under the brand name Benadryl. In some preparations also, you may see doxylamine, so in preparations like NyQuil, Tylenol cold, and cough nighttime, the antihistamine in there is called doxylamine. These ones are more likely to cause problems with BPH symptoms. Now, the second generation antihistamines include the more popular ones like cetirizine, sold under the brand name Zyrtec, or loratadine, sold under the brand name Claritin, or fexofenadine, which is sold under the brand name Allegra. While these have a relatively lower risk compared to the first generation, they should still be avoided if at all possible. The next class of medications we're going to be looking at are decongestants. Now, as the name implies, decongestants are used to relieve congestion, usually caused by a cold. Now, decongestants increase the resistance to urine flow by tightening the muscles in the prostate and the neck of the bladder. So, as is expected, if the muscles in the neck of the bladder are tightened, then it becomes difficult for the urine to leave the bladder. Examples of decongestants include pseudoephedrine and phenylephrine. Now, it is worth noting that decongestants in nasal sprays may not cause as severe an effect as the oral formulations, just because when you use it nasally, you don't absorb as much into the bloodstream to cause these problems. So if you have an enlarged prostate and you have congestion problems, you may need to consider other ways of relieving the congestion. So for example, you may use things like a humidifier, you may use a saline nasal spray, or sometimes even just inhaling steam from a shower will do you some good. Next, we're going to talk about a class of medications called NSAIDs or non-steroidal anti-inflammatory drugs. Now, these may be obtained either by prescription or over the counter. They are primarily used to treat pain, inflammation, and fever. Now, when it comes to NSAIDs, the data is really not a slam dunk, as some studies point to the fact that some NSAIDs can actually shrink the prostate and improve urine flow. Other studies, however, paint a different picture, pointing to the fact that NSAIDs can actually make symptoms of enlarged prostate worse. The general recommendation though is to avoid NSAIDs, but I know it is not impossible for some people, so a discussion with your doctor will be very handy in this particular scenario. Examples of NSAIDs include ibuprofen or Motrin, naproxen or Aleve, which are available over the counter, and meloxicam, sold under the brand name Mobic, which is available as a prescription. The next class of medications are diuretic, or as we commonly refer to them as water pills. Now, they are used to remove excess water from the body via urination. They are employed in the treatment of certain conditions such as heart failure and high blood pressure. Diuretics, just by virtue of the way they work, that is increasing the frequency of urination as well as the volume of the urine produced, may make the symptoms of an enlarged prostate worse. Now, typical examples of diuretics include classic one, furosemide, sold under the brand name Lasix. The fifth group of medications that may worsen enlarged prostate symptoms are antidepressants, specifically a group called Tricyclic antidepressants. Now, these are an older generation of antidepressants, and these days you don't typically see them being used for depression due obviously to newer generation antidepressants with less side effects. They are more commonly employed these days as sleep aids and sometimes in the prophylaxis or prevention of migraines. Tricyclic antidepressants worsen BPH symptoms by increasing urinary retention. Now, typical examples in that class include amitriptyline, nortriptyline, and doxepin. So, high-level overview of medications that may worsen enlarged prostate symptoms. Hope you found some value in it. If you did, I believe you're going to like this video that I've put on the screen as well. Thank you so much for staying through. I'll catch you on the next video and stay blessed.